I know I'm standing in between us and coffee, so I will be brief. But I would just like to say this is a collaborative project between the Centers for Medical Specialty Societies and the CDC. And there are members of this panel here, so if you just raise your hand. So we have a lot of people that are here today representing the panel. No conflicts of interest for any of us. And I'd like to first just draw your attention to the graphic here. So as I mentioned, it's a collaborative project between the CDC and CMSS. And for those of you who aren't familiar with CMSS, it is an umbrella organization that houses a lot of siloed specialty organizations within the United States for physicians. So it represents a little under 1 million physicians. And the purpose of the organization is to help collaborate and create solutions to problems that all of us may face. And as all of you know by now, long COVID affects every organ system, so this was a perfect project for them. So what CMSS did was start by creating an expert panel. So there was a national call for experts. People self-nominated. There was about 90 applications. Of those, 24 expert panelists were selected, and they represented fields such as primary care, neuropsychology, pediatrics, rehabilitation, medicine, public health as well. And there was so much patient interest that there was a separate group that was formed for patients to provide their input. And the expert panel divided into an education work group and a technology work group. And the education work group reviewed over 150 resources which talked about clinical care and guidelines provided by different societies for long COVID. And 64 resources were selected, organized by the 7 domains seen on the left here. So with the pictures, the fatigue, breathing, respiratory, cardiovascular, autonomic dysfunction, cognitive impairment, mental health, and neurological symptoms. And the resources that were selected were graded, and they were really kind of geared towards primary care, because for us in the United States, that's where a lot of patients get their first contact of care, and where people will go once they've perhaps seen a specialist who may not have an answer for them, they will go back. So we really wanted this to be an effort to create concise and easily readable, digestible materials for those clinicians. And all of these were incorporated into digital tools. A long COVID resource repository was created, and they're all available online. And we have all created, and for each of those topics, there's an expert, group of experts that created a short slide set and recorded a 10-minute video to accompany the material. And these recordings will also be used to create podcasts, so multiple ways to engage with people that want this education. And the resources have been shared by other national societies, such as the American College of Physicians, the AAFP, and the American Academy of Physical Medicine and Rehab. So conclusions. This initiative demonstrates that a multidisciplinary expert panel, augmented by structured patient engagement and a systematic review process, can effectively curate, evaluate, and disseminate high-quality long COVID resources. And we think that this supports the idea that creating national-level tools will help strengthen communication across specialties that will ultimately improve long COVID patient outcomes. And I would be remiss to not mention again that the funding to do this project was really critical. The CDC funded the project, and I think without the organization and the project management by CMSS, it would not have happened. So thank you.